Legal disclaimer. This is a discharge protocol written by Dr. Gregory Weir for patients managed by him at his practice at the Life Eugene Moraes Hospital. The content should be discussed with your own doctor and should not be considered as advice if you are not a patient of Dr. Weir. Okay, so let's dive into the source material you've brought today. It seems really focused on wound care.
That's right.
Specifically, how healthcare professionals actually spot infections in wounds. And then there's a protocol, right? A step-by-step guide for care.
Exactly. It's very structured.
So our mission here is really to unpack these tools, these steps, so you can get a clear picture of what's actually involved based on these documents.
Yeah, these sources lay out a systematic way to look at wounds. You move from assessment using these specific indicators we'll talk about right into the practical hands-on care steps. It gives you a solid framework.
Okay, good. So the sources kick off with these assessment tools. The first one is called NRDS. Right, let's unpack that. What's NRDS looking for?
So NRDS is specifically designed for superficial infections, things happening right on the wound surface. It's an acronym. Makes it easier to remember.
Okay.
N is for non-healing. The wound just isn't progressing, you know.
Stalled out.
Exactly. E is for exudate. That's fluid, drainage from the wound. Is there a lot? Is it changing? R is for red, and F is for friable tissue. This means it looks, well, bright red, maybe bleeds really easily if you touch it.
Fragile.
Yeah, fragile. D is for debris, like loose stuff or dead tissue on the wound bed.
Okay.
And S is smell, an unusual or, bad odor. These are all signs pointing to a problem right there on the surface.
Got it. So NRDS is surface level, what you see, what you smell. But then there's another one mentioned, stonies. That's for deeper issues.
That's right. Stonies are looking for signs that the infection might have gone, well, deeper into the surrounding tissue, maybe even close to the bone.
Okay, so what does stone is stand for?
S is for size increase. Is the wound actually getting bigger? T is temperature difference. You feel the skin around the wound. Is it noticeably warmer than elsewhere?
Oh, interesting.
Yeah. O is critical, osteomyelitis. It basically means, can you probe down to the bone? Suggests a really deep infection.
Wow, okay.
N is new breakdown, are new areas of tissue dying off. E is exudate again, fluid, but maybe more of it or different.
Right.
The second E is edema and erythema, that's swelling and redness, but importantly, spreading out from the wound edge.
So beyond the immediate wound.
Exactly. And the final S is smell again, often maybe a stronger or more persistent unpleasant smell with deeper infections. Signs like that warmth or spreading redness, they suggest something more serious is going on underneath.
It's really quite detailed, isn't it, how it guides the assessment based on depth. So, okay, you've used NRDS or stonies, you have an idea about infection. What do the sources say to do then? What's the actual care protocol?
Right. The protocol gives you that step-by-step. First thing, and it's emphasized, is hygiene. Wash hands really well with chlorhexidine soap. Put on clean gloves. Standard stuff, but critical.
Always.
Then, cleaning the wound itself. The sources mention using something like Prontosan, that's a specific cleanser, or just plain sterile saline.
Okay.
And you use moist gauze, gently clean the skin around the wound, and then the wound bed itself. You're trying to get rid of any loose bits, any debris you saw during the assessment.
Makes sense. Remove the gunk.
Yeah.
What about covering it? The sources mention different dressings depending on infection.
Yes, very specific. If the assessment suggests infection, based on NRDS or stonies, the protocol says use Inadine. That's an iodine dressing to help fight the infection.
Okay.
But if it looks clean, no signs of infection, then you use Adaptic. That's a non-stick layer, just protects the wound bed gently.
Right, so the dressing matches the need. What are the sort of final steps in this protocol?
After that primary dressing, Inadine or Adaptic, you put a secondary dressing over it to absorb any drainage and protect it.
Standard cover dressing.
Right. And on an arm or leg, they suggest maybe a light crepe bandage to help hold it all in place. And importantly, reapply it if it gets loose.
Good point.
There's also a very specific note for people with chronic venous insufficiency who might have a venous stasis ulcer.
Those leg ulcers.
Exactly. For those, it says apply graduated compression bandages following specific guidelines. It even mentions looking up the Africa bandage system on YouTube for the technique.
Wow, a specific reference.
Yeah. And finally, really practical point, it gives a contact number for problems.
So bringing this all together for you listening, understanding these tools, NRDS and stonies, gives you a window into how healthcare teams systematically check for infection signs, looking at both surface and deeper clues. And then the protocol itself shows that structured approach to care, hygiene, cleaning, choosing the right dressing based on the assessment and securing it properly. It really shows how observation informs action.
Absolutely. And this combination, the detailed assessment feeding into a precise protocol, it really highlights how something complex like wound care gets broken down and managed. Maybe the thought to leave you with is this. How could breaking down a challenge into these observable signs and then applying clear, actionable steps like these sources show for wounds, how could that approach help you tackle other complex things you might be learning or facing?